What's the first thing you think of when you hear the word radiation? Take a moment here and think about it. Did anyone think of a day at the beach? Or maybe the last plane ride you took? The truth is, radiation is all around us, and we don't even feel it. It's in unassuming objects like the banana you had for breakfast, the earth beneath your feet, or the sun that you enjoy on your face. It is a fact of life. Yet, there seems to be some apprehension when it comes to the use of radiation for dental x rays, with some patients refusing them because they're afraid of harm, even though dental x ray imaging is equivalent to about a few days of living on Earth with normal background radiation. I believe that these fears are rooted in a lack of understanding. To quote the famous scientist, Marie Curie, the one that actually coined the term radioactivity, nothing in life is to be feared, only to be understood. When I was a young girl, she was the woman I looked up to the most professionally. She was a trailblazer and a badass that broke all social norms and pushed the limits of scientific and social acceptance. And she did much of that through taking risks, education, and just incredible grit. In order to invoke her spirit of understanding versus fearing, I'd like to help you understand why we dentists ask for x-ray imaging. So I'd like to tell you a story about a risk I took a few years ago. About 5 years ago, I visited Chernobyl, the site of one of the worst radiation disasters ever. Now, you may be wondering, why in the world would she visit Chernobyl? Well, for those who don't know me, I'm an oral and maxillofacial radiologist, meaning that I'm a dentist specialized in radiology, and I'm filled with curiosity and the desire to push limits. So I'd like to take you to Ground Zero Chernobyl. Come along with me. The power of radiation was omnipresent as I walked around the site, the eerie silence just engulfing me, the relentless vegetation invading all signs of human civilization. This is a land stuck in the 1980s Soviet times forever, where Geiger counters still go crazy beep, 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 as you near teddy bears and musical instruments left behind in haste. And as you look around the landscape, you see the yellow radiation triangle signs popping up like angular foreboding sunflowers. Now, part of the experience was actually visiting the reactor, going into the reactor. And in order to do that, I had to sit in a radiation sensor for about 5 minutes to measure my baseline radioactivity. After that was done, I took off my civilian clothing and my shoes and donned the many layers of protective clothing and took the tour, and it was incredible. And then after it was done and I was back in my clothes, I had to sit in the sensor again. It was one of the longest 5 minutes of my life. My heart was racing. What if I have radiation poisoning? What have I done? What's this? And my breathing only slowed when the technician told me very calmly, "You're clear." When I went back to my hotel room that night, I ruminated on the experience. I was in awe of having been there instead of just read about it or watched it on TV. And this was a really big risk, exposing myself to Chernobyl radiation. But it was a risk that for me was worth it because I gained knowledge about this historic disaster and also insight into the sobering reality of how destructive radiation can be. But it also got me thinking, What if the same fear that I had, that eerie feeling I had while I was walking around in that site, what if that was the same fear that some people have when they have to have x-rays done at the dentist or maybe at the hospital, or even if they have to have radiation cancer treatment? And that filled me with empathy and compassion for those patients. You see, I was taught to appreciate X-rays as a form of radiation that helps save people's lives. They allow me to look underneath your skin and deep inside you without having to cut into your flesh to find what ails you. And it helps me put together the pieces of the puzzle of your condition so I can tell your body's story. As an oral and maxillofacial radiologist, who primarily diagnoses dental diseases, I can tell you with great certainty that many of the conditions that dentists work with or have to deal with are submerged within bone and in densely calcified tissue and are very difficult to see just looking into the mouth. We do need x-rays to be able to visualize them. I'd like to clarify the role of dentists in your healthcare, just a couple of moments here. Dentists are oral physicians, physicians of the oral cavity. And just like any other physician, we are responsible for the diagnosis and the treatment of diseases of this area to prevent the spread of infection and other conditions. Your mouth is the beginning of your aerodigestive tract, so conditions happening in your mouth can affect your breathing, can affect your digestion, and also can affect your cardiovascular health, your neurological health, and your immune system. Yet studies have shown that 10 to 12% of dental patients refuse x-rays. Now, interestingly, when I went back into the literature to try to find similar statistics about medical imaging and CTs and patients refusing those, I couldn't find anything substantial. So what makes patients refuse dental x-rays? Are they afraid of the radiation? Or is it perhaps the perception of oral health in the grand scheme of things? Or is there something in the doctor-patient relationship that broke the trust in the dentist's judgment? There are two operative words here: fear and trust. Trust is very hard to come by when fear is amplified. And fear becomes amplified when there is a lack of understanding and a lack of knowledge. Now, many of us grapple with similar parallel dilemmas in many aspects in our lives, at so many levels. And when we are faced with these challenges, sometimes it's helpful for someone to meet us where we are, to gently take us by the hand and help talk us through our fears. I'd like to validate the fear of radiation. It's justified. Radiation is a scary thing. It is intangible and unknown, an invisible force with the power to harm us. And you have every right to question and to be concerned. But nothing in life is to be feared, only to be understood. Let me help you understand why we use X-ray imaging in dentistry. First of all, in any decision you make in life, there is a subconscious question. You may not even realize you're asking yourself this question. What are the risks versus the benefits of our choices? This thought process can go into any decision, like, for example, the medications or the supplements you're going to take, the school you're going to attend, the tub of ice cream in the freezer that's calling your name, or even coming to an event like this one, where the benefit of us all coming together and sharing ideas far outweigh the risk of getting into an accident along the way. Similarly, the benefit of getting the right diagnosis and basing the correct treatment upon that diagnosis outweighs the risk of radiation damage. Another thing to consider is that medical industry is working very hard to reduce radiation doses to patients. And almost on a daily basis, we hear about new breakthroughs in radiation dose protocol reductions. Since Chernobyl, since the 1980s, medical radiation doses have been reduced by 50 to 90%. And in fact, in a recent statement by the American Academy of Oral and Maxillofacial Radiology, my specialty, they recommended not using the heavy lead aprons anymore because the radiation dose is so low. And because those lead aprons and lead thyroid collars, they degrade the image. And lastly, for any professional to be certified to handle radiation, there is a considerable amount of training and education that they have to go through. And there are strict rules and regulations to make sure that they not only keep their patients safe, but also themselves safe. One of these rules is ALARA, which I thought was a very cute name for a girl. I mean, my husband's a radiologist and I'm a radiologist, and I'm like, hi, wouldn't it be cool to call my daughter ALARA after this radiation rule? And then, we had a conversation. He's like, you remember what it stands for, right? As low as reasonably achievable. Which is not the kind of mantra you want your kids to live up to, right? So I hope I've opened up some doors to you about more knowledge about X-rays and healthy respect for what X-ray imaging entails. And perhaps now is the time to empower you with a few questions to ask your dentist to help further reduce your radiation exposure. It's already quite low, but to even bring it down even more. Before you actually have the imaging done, you want to ask, what is your diagnosis? And what more do you want that X-ray imaging to tell you? And is there another way you can come up with the same answer without using something that uses X-rays? Now, if your dentist is still adamant that they need these X-rays, like for example, if it's been a while since you've had them, or you don't have any, I'd like to ask you to trust them. But you can ask them, what can you do to reduce my exposure to X-rays? How can you give me the best diagnostic image with as little radiation as possible? That's what ALARA means. As low as reasonably achievable radiation. And of course, there are other iterations of ALARA that tell you that we need to get the best diagnostic image with as little radiation as possible. The diagnosis is key. Have the courage to advocate for yourself, but also have the courage to trust. What did Chernobyl teach me? I witnessed and was filled with respect for the incredible power of radiation. And I carry this experience with me every day. And with every patient I help diagnose, I see how this awesome power has been harnessed for the greater good of humanity. But you know what the more important lesson was? It helped me connect with those people who are afraid of radiation and X-rays. If you are afraid of radiation, I feel you, I see you, and I understand you. But as someone who also sees the benefit of an early and correct diagnosis, I can tell you that by getting that early and correct diagnosis, that's going to keep you from going down a rabbit hole of incorrect and improper treatment that can compromise not only your oral health, but your general health as well. So I'd like to invite you to trust. The lesson to be learned here is that knowledge and understanding give you power and trust, while fear takes them away. Nothing in life is to be feared, only to be understood. Let's all make Madame Curie proud. Thank you.